This is a chest X-ray, which is in posterior anterior view, and the patient is in erect position. The trachea appears central, it's a well-rotated and a well-exposed film. The mediastinum and the bony cage appears normal. However, there are 2 millimeter diffuse nodular opacities throughout both the lung fields, indicative of miliary mottling, which could be seen in conditions like miliary tuberculosis. It can also be seen in pneumocystis jirovecii infection. It can be seen in coccidiomycosis and histoplasmosis. It can also be seen in conditions like lymphangitis carcinomatosa. The chest X-ray of a person in erect position, posterior anterior view, and the exposure is good, and it is a little bit rotated to the left side because the spinous process is toward the left head of the left clavicle compared to the right. The exposure is good. What we see here is opacities in the pleural margin, and they are rounded opacities in the left pleural margin, and there are 2 of them, opacities that are seen in the mediastinum. The diaphragmatic contour on the right side also appears irregular. There is blunting of the CP angle on the left side, indicative of a mild pleural effusion or a pleural thickening. This patient turned out to have multiple pleural fibromas, and fibromas were also present in the mediastinum. This is an erect chest X-ray PA view, and it's a well-exposed film, well-rotated film. Now what we see here is the mediastinum is central, but it has a globular appearance. The heart is globular. There is blunting of CP angles on both sides, indicative of a pleural effusion. The minor fissure also has fluid in it. So this patient turned out to have acute pericarditis with a pericardial effusion and bilateral pleural effusion. What about this X-ray? What is the obvious thing in the lung fields here? The mediastinum is central. However, there is extensive reticulonodular opacification in upper, mid, and lower zones bilaterally with cystic changes within. This could mean a fulminant viral pneumonia, like COVID. It could be present in acute interstitial pneumonia. It could also mean long-standing tuberculosis, pulmonary tuberculosis, with bronchiectatic changes inside. These cavitating nodules can also be seen in conditions like pneumocystis jirovecii, staph pneumonia, Klebsiella, anaerobic infections like lung abscesses, fungal infections like histoplasmosis and coccidiomycosis. This X-ray shows an opacification in the left upper zone and mid zones, and it is convex in shape and it's abutting into the pleural wall. So this could be a consolidation, or it could be a loculated pleural effusion. It could even be a mass arising from the pleura. The mediastinum and the rest of the lung fields appear quite normal. This patient just turned out to have a consolidation, which was proved by a chest CT scan, and she did very well with antibiotics. This is an erect abdomen X-ray, and it shows most prominently air under the right hemidiaphragm, which is usually indicative of a perforated bowel. And it could also mean that the patient has a subdiaphragmatic abscess. But in this case, with dilated bowel loops seen, especially colonic loops that are seen, this patient turned out to have sigmoid colon carcinoma with a perforated bowel just above the sigmoid colon cancer, above the obstruction.